Topic: myopia. What causes nearsightedness?
Excess staring at junk food.
No. When light from an object enters our eyes, our eye lens bends it such that the image is formed on the retina. However, in some people, this image is formed before the retina. Such defect is called nearsightedness or myopia. A person with myopia cannot see distant objects clearly.
But why?
Wait, I'll explain. To focus image of a distant object on the retina, our eye lens becomes thin. However, in people with myopia, the lens cannot become adequately thin, thus forming image before the retina and making it difficult to see. Moreover, when the eyeball is elongated more than normal, the distance between the lens and the retina increases, resulting in the formation of image before the retina, thus causing difficulty in seeing the distant object.
Origin of the word. It comes from the Greek word myops, meaning short-sighted. These people cannot see distant objects clearly. Anatomy. Before we describe myopia, let's compare the eyeball to a camera for better understanding. When we take a picture, light after reflecting from an object enters the camera and passes through following. Firstly, it passes a transparent glass in front of the aperture of the camera. Then secondly, it passes a camera lens that helps us in focusing light rays. And lastly, there is a camera film on which light is focused for a clear picture. Eye is somewhat similar as when we see an object. Light after reflection from that object enters our eye through. Firstly, it passes cornea, the transparent curved front part of the eye. Then secondly, it passes through the crystalline lens that helps us in focusing light rays. And lastly, there is the retina. Light-sensitive receptor cells in the posterior part of the eyeball, on which light is focused for a clear image. Definition of myopia. It is a form of refractive error, inability to refract, bend, focus the light rays properly, in which parallel rays of light, i.e. coming from a distinct object, after entering the eye, are focused in front of the retina instead of on retina with eye muscles at rest. Causes. Curvature. Increase of curvature of cornea or lens causes light rays to be focused in front of retina, and hence myopia occurs. Axial. Increase in axial length of eye increases the converging power and cause light rays to be focused in front of retina. Index. Increase in refractive index, i.e. light bending, focusing power of the lens, for example in cataract. Positional. Anterior displacement of lens, e.g. after trauma. This again causes light rays to be focused in front of retina. Types. Congenital, from birth. Simple. Most common, starts from 5 to 10 years till 15 to 20 years and is mostly due to curvature or length problem of eyeball. Pathological. Hereditary, progressive, and is due to degenerative changes in the eyes. Clinical features. Symptoms. Blurred vision. Half-shutting of eyes. Parents of child will tell. Outward deviation of eye. Divergent squint. Normal patients require to move their eyes inward while focusing near objects. This is not required in myopic patients, causing their eye to move out intermittently or constantly. Signs. Prominent eyeball, as eye is big. Retinal changes, in pathological myopia. Diagnosis. Retinoscopy. A handheld device that throws light in the eye and allowing us to observe its movements and reflection, hence helping to confirm the refractive error. A scan. A small ultrasound probe that throws ultrasound waves in the eyeball and then detects their reflections or echo timings, calculating the eyeball length. Treatment. Unlike the camera, maximum 2/3 focusing in an eye is done by the transparent front part, cornea, while the rest, 1/3, is done by the lens. So, while treating these patients, we have to decrease the focusing power of the eye so that the image is formed on the retina instead of in front of it. This can be done by using either a diverging lens like glasses, contact lenses, or some surgical procedure. Surgical treatment. Flattening the central part of cornea. This includes different methods that were changed and advanced, depending upon reduction of side effects and recovery time and improvement of degree of vision. The surgeries included in this category are radial keratotomy, photorefractive keratectomy, LASIK, laser epithelial keratomylosis, LASIK, laser in situ keratomylosis. Other surgical treatment options are lens extraction, contact lens implantation,